I think most women, when they hear the term testosterone, think of men and muscle. Actually, you should be thinking estrogen, because that's where a lot of your estrogen comes from. As testosterone levels decrease, so does your estrogen levels. And that is what puts you into menopause. Testosterone and estrogen combined have a role to play in, firstly, sexual health. A decrease in those lead to a decreased libido. We don't think about sex as often as we used to. Sex drive that goes out the door. Lubrication that starts decreasing, and sometimes that leads to pain. Cognitive decline is directly associated with decreased estrogen and testosterone levels. And women with low estrogen are 4 times more likely to develop Alzheimer's disease than those who are on hormone replacement. Testosterone will help us with concentration, motivation, energy levels, fatigue. What I see in my practice is that for most of you, as women, a big stressor is weight. Now, your hormones, both estrogen and testosterone, has a very big role to play in exactly that. Our gut health, sleep, well-being, and quality of life are directly impacted by changes in hormone levels that cause an imbalance. The changes a woman experiences as hormone levels start changing and decreasing are very complex. Firstly, we deal with the stage of perimenopause, and this is usually from about 43 to 50. Symptoms are nondescript. I'm just not feeling well. And when you go to your doctor and you look at your hormone levels and say to you that nothing's wrong, they're still fine. And you go away and you feel, am I going mad? And then we go to our 50s when we now are menopausal, whether you are menstruating still or not. And from the age of 59, you are classified as postmenopausal. So testosterone converts into estrogen as we start having irregular menses and irregular ovulations. The testosterone production decreases, and this has a direct role to play in how much estrogen you're producing. The symptoms now start becoming more definitive. Hot flushes, sweating at nighttime, mood swings, irritability, depression, fatigue, weight gain. Not necessarily weight gain as much as changes in body composition. Everything that was firm and high now sag and go to your hips. Now we go back to our doctors and, okay, you're in menopause. I'm giving you hormone replacement therapy. And that doesn't really work for you. Why? Because the system is still unbalanced. What we do at the T clinic is we do a consultation. We find out exactly what it is that you are still battling with. We look at the blood tests, quite extensive, and see where the imbalances actually are. By rebalancing and optimizing the function of each of these hormone systems, we create balance, bringing back quality of life and well-being. So, how do we treat you? This might include various things, from hormone replacement therapy in the form of estrogen, Often, and more often than not, it would be optimizing testosterone levels, which is really what the cause of all of this is. Supplementation, optimized supplementation, bespoke made for you. IV nutrient therapy often play a role in our treatment protocols. We keep track of our patients as often as once a week sometimes, most often at least once a month, for the simple reason, as we start changing the hormone systems, everything change. My patients, I often use the analogy of a recipe that we're baking. If you change one thing in the recipe, it's going to give you a different taste in the end product or the end cake. We now have to balance the whole recipe. And when you get that right, award-winning cake.